he's an expert. So I'm just tapping more from him for everybody's benefit. Doc, I heard you do your presentation that for every woman in reproductive age group, when you come to the hospital with any condition, you are likely to be tested for pregnancy. How common is ectopic pregnancy and what is it?
Okay, so ectopic pregnancy is, I won't say is very, very common. Okay, but it's something that is serious and therefore we don't want to miss. We see it quite a bit in young women, all right, especially in patients who have had repeated pelvic infections that wasn't properly treated. Okay, so some people, they say, oh, menya white, then they go and buy some medication out there on the markets, all right. With the repeated pelvic infections, usually they may get scarring in the fallopian tubes. And if you get scarring, with time, then the lumen becomes narrower and it's not straight. Therefore, you are prone to getting ectopic pregnancy. Okay. So it's not something that is very, very common, but all the same, it's one of the leading causes of maternal mortality in Ghana and worldwide as well. In Ghana, if you take the top 5 reasons why a pregnant woman will lose their life, ectopic pregnancy is one of them. So it's still a leading cause of maternal mortality that deserves our attention. Okay.
All right.
I've forgotten the other part of it.
I was just asking how it presents.
Okay. Yes. So typically the woman may have missed the menses, or sometimes in quotes, they will tell you, oh, my menses 2 weeks ago. Then they are now having their menses again. Their menses in quotes. And then they will be having lower abdominal pains. And some of them, they will have dizziness, palpitations. That's they become aware of their heart beating. And for some, they collapse. Okay. For some, the first presentation is a sudden collapse. The person was well. They woke up going about their duty. Then suddenly they collapse to the floor. Okay. So these are the commonest ways by which they present. But most of the time, is the lower abdominal pain that prompts them to actually come to us in the hospital. It's a lower abdominal pain. Otherwise, if it gets to the late stage where the ectopic pregnancy ruptures and they start bleeding into the abdomen, then they may have signs of anemia, which I was talking about, dizziness, palpitations, they get tired easily, even if they take a few steps. Okay. And generally, they may also look pale. If you look at the person, you realize that they look pale. Okay. Yes. So these are some of the signs. These are some of the ways by which they present to us in the hospital.
Yeah, Doc, I heard you mention something very serious about some ladies who, in a bid to terminate an unwanted pregnancy, may go do other things without knowing where the pregnancy actually is. So it could be actually be an ectopic pregnancy, but they try to terminate